So my name is Mary Ersek, and I am a professor of palliative care in the School of Nursing at the University of Pennsylvania. So the Dying in America documentary is actually the second documentary that was produced and directed by Carolyn Jones, who's a documentarian out of New York City. And her original documentary, which is The American Nurse, arose out of her own experience as a breast cancer patient. And during the chemotherapy and other therapies that she had for her disease, she realized that the people who made a huge difference in her experience were nurses. And so she's made a commitment to nurses, but first in this documentary called The American Nurse, where she interviewed about 100 nurses. And I think what she realized is that many of the nurses she spoke with in The American Nurse had experiences around caring for people who are dying. And so that prompted in her this idea that, well, what is nurses' role in taking care of people who are at the end of their life? Carolyn Jones was invited to sort of a premiere of The American Nurse at Penn. And she was part of a panel discussion. And one of the graduate students who knew of my work realized that Carolyn's next project was in end-of-life care. And so she said, oh, you should talk to Mary Ersek. And I had actually sent Carolyn a long list of names of my colleagues who she should talk with. And because I've been in the field so long. And she got back to me and said, oh yeah, great, thanks for the recommendations, but we'd like to interview you. I think the thing that Carolyn's documentary demonstrates is, I think healthcare, but particularly palliative care, is a team endeavor. And so I'm lucky I get to work with wonderful chaplains and physicians and social workers and psychologists. It's an interdisciplinary team. One thing that I think Carolyn wanted to capture is the voice of the nurse. And it was interesting when she was interviewing me, because I would say, well, and then we, in palliative care, we get the team in there, and I would mention, colleagues of mine that I was so grateful, and then the chaplain came in, and it was wonderful because I couldn't address these issues. She'd say, now stop, you nurses, you're always talking about giving credit to someone else. And so it really is sort of a singular view of what nurses do. And I think that's a strength. I think very often when I watch documentaries on end-of-life care or on palliative care, they usually feature my physician colleagues who are wonderful, but very often, these palliative care teams are co-led, often by a nurse practitioner or a nurse and a physician, and very often, the person who gets interviewed is the physician. So it was, I think the importance of Carolyn's work is it gives the voice of nurses in this really important endeavor, even though it is a team endeavor.